Now we're talking closed chain osteokinematics. So now the femur is being held in place and the pelvis, the innominate, is moving on that fixed femur. If we do an anterior pelvic tilt in that sagittal plane, that's relative hip flexion. If we do a posterior pelvic tilt where that pelvis rotates posterior, that's going to be relative extension at that hip joint. So let's review that one more time. If you're sitting in a chair and you bend forward, not using your trunk, but using your pelvis, that's hip flexion, closed chain. If you lean back from your pelvis, so you roll back on your pelvis, that's relative hip extension, closed chain hip extension. Let's talk about closed chain abduction and adduction. So if you are standing on your right limb and you bring your left limb off of the ground, so you hike the left side of your pelvis, that's going to be relative abduction on the right side. Let's talk now about adduction. Again, I'm standing on my right leg, and now I let my left pelvis, so the opposite side of the pelvis, drop. That's going to be adduction on that right side. So that's closed chain adduction. Horizontal plane. Again, if I'm standing on my right leg and I rotate my left side of my pelvis forward, that's going to be internal rotation on my right leg. If I'm standing on my right leg and my pelvis on the left side goes posterior, that's going to be external rotation on my right leg.